just wanna have fun, clap my hands, turn around now and dance, dance, dance. I just wanna have fun, clap my hands, turn around now and dance, dance, dance. I just wanna have fun, clap my hands, turn around now and dance, dance, dance. I just wanna have fun, clap my hands, turn around now and dance, dance, dance. I just wanna have fun, clap my hands, turn around now and
Yes!
dance, dance, dance.
Yes!
I just wanna have fun,
Yes! Good day, beautiful people. How are we feeling?
Hi, hi.
How are we feeling? Aha, that's what I want to hear. I'm super excited on stage, a different one this time around. We're at the Orange Room, and today we're basically going to be having a conversation about CeraVe and all things acne. Alrighty. Okay, so right with me, I have none other than Dr. Dadoo, who is going to be taking us through what exactly acne is and give us insight on how to treat acne and how to treat your skin if you are someone that is currently battling skin conditions like acne.
Yeah.
How are you, Dr. Dadoo?
I'm good, I'm good.
Good, good. Shall we?
Lots of excitement today, yeah.
Right? I'm so excited. Are you guys excited? Yes. Alrighty. I think we can get straight into it.
Okay.
You can have a seat. Alrighty. So, my beautiful people, like I have mentioned, that today we're speaking all things acne. And I think it is very important to have Dr. Dadoo here, someone who is an expert, right, in the dermatologically right? To actually give us an insight on what acne is. I think, Dr. Dadoo,
Yeah.
would you like to give us an explanation on what acne is? Because we know it as this creeping monster that just comes into your life and just deteriorates every single thing that you've worked towards and just,
Yeah.
it tears you apart. But
Yeah.
what is exactly?
Yeah. So acne, I think in its simplest explanation, it's what we call an inflammatory condition of the skin, an inflammatory disorder of the pilosebaceous unit. So what that means is the hair follicle and the oil gland becoming inflamed. That's like the main kind of underlying problem with acne. And as you said, it can be quite devastating. You get the milder end, of course, and then you get the really severe cases with nodules and cysts. But it's all acne, and it's all kind of just a progression of that inflammatory process. Yeah.
Okay.
Yeah.
Okay. So basically, in your terms, that is what acne is.
Yes.
It's basically when your skin is inflamed,
Yeah, yeah.
right?
Yeah.
And what are the most common causes
Causes.
of acne?
Yeah, so there's lots of misconceptions about acne, firstly, like things about, avoid all these sugary foods and things like that. There is some evidence for that. But when I talk about causes, I mean like in terms of the actual underlying what's going on in the skin, why is this happening? So one of the key things is the hormonal influence on your oil glands that cause your oil glands to produce more oil. So that's one problem. And then the other major thing that kind of goes wrong is your pores getting blocked or clogged. So the pore is actually an opening of that hair follicle and oil gland to the surface of the skin. And then you get a buildup of dead skin cells, oil, and keratin, which is the protein that your hair and skin and nails has. So those three combine and they block the pore. And then that's not good because that gland underneath has nowhere for the oil to escape through. You get that oil building up. There's a bacterial kind of overgrowth in that area that likes that oily environment, and then that whole unit just bursts into your deeper tissues. If it's and that's when the inflammation actually is very visible because your body tries to clear that now. So it sends out its immune cells, and then just depends. Some people have like an overreaction to that oil and bacteria that have leaked out. So yeah.
Okay, and then I think my personal question is, so diet doesn't have anything to do with acne.
So the studies are still not conclusive. There are some smaller studies saying that very high glycemic index diets potentially, so very sugary kind of diets where your sugar goes up, spikes and comes crashing down quite quickly. And then they do say milk, but specifically skim milk, and possibly whey protein as well. But again, this is not going to be for everyone. How I would advise patients is if you feel like those things do trigger your skin, then definitely avoid them. But it's not like a blanket thing to tell everybody don't have skim milk and this and that. And yeah, so yeah.
Well, you might have said that too late because as for me, I know I've told a few people that guys do not eat peanuts because one thing about peanuts, they will rock your acne like they are going to trigger it, right? Because I myself have also had acne before. You know, I think at a very young age, I started having skin problems, and acne was one of the biggest concerns that I had when it came to my skin. And it was very, very difficult to navigate my life having acne. And it got so much worse when I now got into the podium as a public figure, because then now it's just like, okay, Queen, that's you. I don't know, but people have very high standards that they put against us as public figures, because they just expect you to be perfect all the time.
Yeah.
And it does come with a lot of pressure, you know. It does come with a lot of disadvantages, especially when it comes to how you see yourself and how your self-esteem is built, you know. So I've had quite a challenge with acne, and I think for the longest time I've been a person who has been trying and build a healthier relationship with their skin. And that is how I actually got to get introduced to CeraVe. And it's actually so crazy that I started getting introduced to CeraVe when I was 18, I think, and a friend of mine referred to me to a product, right? He referred a product to me that I think this might help, because you know when you have acne, you try and look for solutions everywhere. And one thing about us, we're gonna try and give you the solution. Chumi, Colgate, come on, acne. Friend, yabona bathi kunenye turmeric, uthi bicarbonate. Like, guys, where?
No.
How did we get there? I feel like looking back at the looking back at those moments where I was so desperate for a solution, I'm just like, it is so out of pocket, you know, how desperation can lead you to so many things that are so untrue. And I'm glad that we're having this conversation, because there could be someone in this room that is currently going through the same challenge as me, and they're trying to find a solution to their skin condition, and they are struggling to. And it is so easy to be gullible when you are in desperation. To fall into some of the misinformation that is being shared out there as to
Yeah,
what
definitely.
could be possibly good to use for your skin, and
Yeah.
what could possibly work for your skin. Now, to move on to my next question, is that I want to find out how exactly do you manage your acne? If you're someone that is struggling with acne, how do I manage it? Because it is something that is continuously with
Yeah.
you. Like, it's literally right behind you.
Yeah. So I think I always like to keep things simple. I'm like a skin minimalist. So if your acne is on the milder side, then definitely there's lots of things you can do at home, lots of products that you can use. CeraVe Blemish Control Cleanser, for example, being excellent in that regard. But I would start with those kinds of products, having something that's exfoliating, maybe introducing a vitamin A type of like a retinol derived product, and just keeping things simple, having a good sunscreen as well. So I usually tell people try the more simple stuff with brands that are reputable, that have the evidence, and that we actually know are effective. And then give it a good shot. If that's maybe not clearing and not getting you where you want to be, then I think after that, maybe let's say you give it about 6 weeks to 3 months and you see you're not clearing up, then I think it's worthwhile going to see a professional to get more advice. Maybe you need a prescription, or maybe you just need to tailor a few more of the active ingredients to your type of skin and your severity of your acne. Yeah.
Okay.
Yeah.
So it does also need some time. Obviously, the products do need some time to effectively
Yeah.
work on your skin. It's not an overnight. It's not magic.
Yeah, yeah.
Magic, abracadabra.
Yeah.
You do need time to actually clear your acne.
Yeah.
Okay. Now, I want to find out. I think because I've been with CeraVe for quite some time, and I get to share my experience with my skin journey as well. The most common question that pops up in my comments is, can the blemish control gel and the retinol serum be used together?
Yeah. Yeah, so I wouldn't use them together. They both can be exfoliating, and retinol itself can be, especially initially, a bit irritating to the skin. And then the blemish control gel, it's got alpha and beta hydroxy acids. So you're going to be using two almost like exfoliating type of ingredients at the same time. So I wouldn't do that. I wouldn't layer those. I would, if you want the benefit of both,
Okay.
I would use retinol one day and the blemish control the next. So you could even make it like clearly like Monday, Wednesday, Friday, you use the retinol, and every other day you use the blemish control gel, for example. But again, also respecting your barrier. If your skin is feeling dry or irritated, don't like push it. You know, if you can only do it 2 or 3 times a week, that's also good enough. Yeah. So that would be my advice about using those or how to
Okay.
use them. Yeah.
And then a quick question, very random. Um, as someone that is working towards having a healthy skin, how many times should I do my skincare routine in a day?
In a day. I think morning and evening is a good way to just break it up. I think that's generally what most people are hopefully doing. With regards to cleansing, I do feel like the evening cleanse is actually the most important because if you think about it, at the end of the day, you've got sweat, sunscreen, pollution, bacteria, germs from your cell phone, your hands, all of that. So to sleep with that, of course, is not great, as you can imagine. So that would probably be the most important, to use your cleanser in the evening. And depending on how your skin tolerates things, you could use the same cleanser in the morning. But just keep it simple: cleanse, moisturize, sunscreen, and in the evening, cleanse and maybe one active product plus or minus a moisturizer, depending on if your skin is dry. Yeah, if that helps. Yeah, so simple, just morning and evening. I mean, there are people who have 10-step beauty routines, but I don't really Korean 10-step, all of that glass skin. But I'm like, you can still get that, but just with minimal and knowing which ingredients work best. Yeah.
Okay, I think you said something there about moisturizing. I know there was a point in time where I was peak acne, like very peak acne. And at some point, I wouldn't even think of moisturizing my face because I thought it would worsen
Yeah.
my acne.
Yeah.
Is it important to moisturize your face when you...
Yeah, yeah. So it is. It is important whether you have dry skin or oily skin or acne-prone skin. So I think that's another one of these like misconceptions that people thought if you have oilier skin, you don't need to moisturize. But we're finding more and more that people who have acne do have like an altered level of ceramides and other kind of hydrating and moisturizing factors in their skin. And that actually leads to irritation and further inflammation. And we've already said that acne is primarily an inflammatory condition. So you don't want to do anything that could potentially worsen that inflammation. So it actually is important. And then, of course, you get products, CeraVe, all of their products have ceramides in it.
Yes.
And ceramides are the lipids which keep your top layer of your epidermis of your skin hydrated and moisturized. So it's also good to use a product that has ceramides that are what we call skin identical, where they actually match the ones that your body is producing or trying to produce. But yeah, I mean, if you have oilier skin, of course, you can go for a lighter moisturizer. You don't have to put on like a rich, heavy night cream type of moisturizer. So that's another way. But definitely everybody needs to moisturize. Yeah.
That's right. Now, my next question is...
Oh, didn't.
Can you guys still hear me? Oh, okay, sorry. Ooh, technology. So my next question now, Dr. Dadoo, is what is the most important thing to remember when you're treating your acne?
Yeah.
What would you say is the most important thing to be cognizant of when you're treating your acne?
I think, like you said earlier, like giving it time, things do take time to work. People sometimes are in a hurry. And a lot of products also need to be built up gradually. So even a retinol product, even if it is a gentler one, I usually advise people, do that slowly. You're going to be using it for a long time. It's not like you have to go in every single night from the day you get it. So just, keep it simple, respect your skin barrier. I think that's another key thing. So don't use too many actives, and then you develop like an eczematous type of skin or a dermatitis, and then you have another problem on top of it. So always respect and listen to what your skin and your body is telling you. Yeah.
Okay. You know what is the most funniest thing that I've ever experienced as someone that has an acne-prone skin? You know when you start using a product on your face and you use it for too long and you actually start seeing change, and then you're like, maybe let me add something else just to... And then you go back. That is probably the most like horrendous thing that you can ever do. So,
Yeah.
do you think it's important to stick to a a routine when you're treating your acne and not change anything about it over time? Because, you know, like as people share, we just sometimes want to, let me just add like another man, just to man.
Yeah, no, look, I think if what you're using, if it's helping, if your skin is clear and you're getting the results you want, then you obviously don't need to, add anything in and look for problems essentially. But I think if you feel like you've reached like a plateau with in terms of your acne improving and your skin improving, then it may be time to consider adding something else in, looking at active ingredients carefully, like salicylic acid, retinol, glycolic acid, all of those types of things, and seeing maybe where you could put that into your routine. But again, not like going overboard, just one at a time, introduce them slowly, see what works. When you're happy, give it a few weeks at least, 6 weeks to maybe even 3 months to know for sure. But if it's getting worse despite all of that, then definitely you need to maybe see a professional and get a tailored plan for you, and that might include prescription medication. Yeah.
I hear you. Valid. Now, I've been in a situation where I wasn't able to afford a dermatologist or to go consult for my skin. What would you say are, if you had to give us some tips
Yeah. Yeah.
on how you can treat your acne at home?
Yeah. Yeah.
Home remedy. How can I treat my acne at home? If I don't have the means to
Yeah.
go consult with a dermatologist, how can I
Yeah.
treat my acne at home?
Yeah, that's a good question. I think that, again, simple is always better. Choose key things. Don't go and spend like thousands and thousands on just the latest fad and things. Try and look at ingredients more. And with acne, like I said, it's the kind of common things that we use, like salicylic acid, glycolic acid, exfoliating acids, retinol as well. So, yeah, I think you have to just take your time, build it up slowly, and try and get the maximum benefit from the product you're using. So try and use it, as it's supposed to be used also. So for example, or maybe something that people don't really know, which I like to advise my patients about is, for example, if you're using a cleanser, in this case, let's say the blemish control cleanser, you do need to rub it really nice and deeply, like massage it into your skin. You want that salicylic acid to really get into your pores and kind of lift all of that sebum and dead skin and all of those things out. So that whole other inflammation story doesn't happen. And then another thing that maybe is another tip, just with, I think everyone, to be honest, should probably be using a retinol, even if it is just for like anti-aging benefits and things, but they definitely help with acne. But again, if you can't tolerate retinol, that's fine, there's alternatives. But also there is that moisture sandwich technique, which you can do, where you, in the evenings, would cleanse, apply a thin layer of moisturizer, you put your retinol-based product over that, and then a second layer of moisturizer. So especially in the start, if people are worried about getting irritation, then that's another little tip that I think maybe people do know about it. I've seen it on social media, but I still advise people to do that if they've never used retinol before. Yeah.
Alrighty. I think I want to move on to my next question, which now targets the social impact of acne and the emotional impact of acne. And I want to find out what do you think are the emotional impact
Yeah.
impacts that acne have on people and on the society?
Yeah, I think, look, we can all probably relate to acne and having had acne. They say about at least 85% of teenagers will have acne. And like I said, of course, some can be much worse or much more severe. But for some people, even a few pimples are, soul destroying, and they're not happy. And it can lead to depression and anxiety. And yeah, there is a way to kind of, in a way, remedy that or help with that, which is to give someone clear skin. So it's not about being vain or arrogant or being, that like, I want to look the best just because of the fact. But it's just because as a society, that's how we are. We judge people. We look at your face. If someone has acne, usually have some sort of negative perception. And I think we internalize that. And that's why it leads to depression and things. But if you can get skin clear, why not? If it makes you feel better, if it gives you a self-esteem boost, then I think that's what's most important.
Alrighty.
Yeah.
Your skin looks absolutely amazing. Like, we're currently having a conversation about skincare, and this man's skin is wow.
Thank
Dr.
you.
Dadoo,
Thank you.
do you want to maybe... Wow, I am so amazed. Is there a story that you would like to share with us? Maybe have you ever battled acne
Yes,
as
yes,
a, as a
yes.
as a teenager?
Yes,
And if you'd care to share with us, please.
Yeah.
How was navigating?
Yeah, no.
How was it navigating that?
Yeah, yeah. So people, you look at my skin maybe and be like, oh my gosh, she has perfect skin, whatever it is. I don't
Yeah.
know. I'm not saying that. That's what you said. But definitely when I was a teen, I also had quite severe acne. I actually had to go onto isotretinoin, which, yeah, so quite high doses. This is probably when I was like 16, and especially for my back. My back was really bad, like very painful nodules and cystic type of acne. So yeah, I remember going through it. It was a while ago now, but yeah, I've been quite miserable, not feeling great about myself, and then being on medication that just dries you up and gives you cracked skin and lips and everything, and yeah, just feeling. But look, at the end of the day, I'm glad also that they forced me. My parents made me take the medication and do the things and get the help. But yeah, so just to show you that everyone goes or can go through this. It's not,
Yeah.
yeah.
I think I really am enjoying this conversation because it is so informative, all right? And one thing I also appreciate about this specific platform and CeraVe specifically is that it bridges the gap between skincare and the ability to be able to afford a good doctor to help you with your skin. Because I know there are a lot of people who don't necessarily have, the means to go and consult with a derm, and with a brand like CeraVe, it is bridging the gap between the health of your skin and the need to also find a derm that's going to help you with your skin. So with CeraVe specifically being developed with dermatologists, it is actually stepping between that gap and giving people the access to having products that are helpful to your skin, right? And to just close things off, I really enjoyed this conversation, Dr. Dadoo. I think it was very, 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 very much informative. And I should say that if there's anyone in the room that is currently struggling with acne, I'm glad that you're here because it means that you are willing to find out more about what your skin is going through. And I hope that you do consider some of the things that Dr. Dadoo shared with us today, and you do implement them in your skincare routine. And I also want you guys to remember that acne might bring drama to your life, but with the right kind of care, always remember that you control the storyline. Dr. Dadoo, thank you so much.
Thank you. Questions?
Oh, okay, I was quick there to leave. So I'm obviously going to open the conversation to the floor. If we do have any questions, please do raise your hand, and Dr. Dadoo will
I'll try to.
make sure to answer your question. We have a few hands. Yes. Hello, sweetie. Hi.
I,
I just want to ask a question around acne scarring. So, younger me had acne, but I have very.
I don't think I'm going to hear you, my angel.
Okay, can you hear me?
yes,
better?
yes.
Okay. It's just around acne scarring. So, as a child, I did have some acne and I have very slight scarring. And I know a lot of people, a lot of women use microneedling and chemical peels to kind of assist with that scarring. Is there any CeraVe products that will assist with fixing the acne scarring?
Yeah, so scarring is difficult to treat. That's a bottom line, and you get different types of scarring, different depths, different locations. I always like to advise people on a combination maybe of topical ingredients and things that they can use at home, and sometimes then combining it with in-office procedures like microneedling or peels. So I think there's a role for both. It's not like an either or. They can work in conjunction to get you the best outcome. But in terms of like specific products with CeraVe, definitely the retinol resurfacing serum. I think the name kind of tells you with resurfacing. So all retinols help with scarring, collagen stimulation, post-inflammatory pigmentation. But specifically in the CeraVe blemish control range would be the retinol resurfacing serum. I do like that product a lot as well because I feel like it's very gentle. It's got this encapsulated retinol with like a slow release mechanism, so you don't get like a massive dose all at once. And then, yeah, I think it's just, again, respecting your skin barrier, keeping it hydrated, moisturized, not doing too much to it. Exfoliating acids can also help minimize scarring or at least more superficial scars. So again, something like blemish control with salicylic acid and the gel, which has glycolic and lactic acid as well. But yeah, but there is a role for microneedling and all of those. There's some fancier you get now microneedling where you can combine it with things or growth factors and things like that, which actually also help to stimulate new collagen production. And so there is a place for all of it. Yeah, yeah.
Thank you so
Alrighty. Do we have another question in the room?
Got more.
Thank you. Sorry, I just wanted to find out with regards to purging. So, like anytime when you start a new product and you like purge on your forehead or on the side of your cheeks, is it just everything rising up to the surface, or do you need to discontinue use?
Yeah, so purging, I think, I don't know if there's like a universally agreed definition of it, but basically it is when you start using most often a retinoid or vitamin A derived product, you kind of get this worsening where your blackheads maybe come to the surface, and sometimes even the inflammation gets a bit worse before it gets better. So I just like to explain it as it's speeding the retinoid products, they're speeding up your skin cycle. You know, they're reducing the time from the bottom layer of the epidermis where the cells go up to the top, so the shedding, and that's why you get a bit of dryness. But in doing so, it also kind of brings everything up. And I usually tell people not to stop and actually to try and push through, but also to prevent having like a hectic purging response is to gradually introduce your vitamin A derivative or your retinol product. Not, like I said, every single night from day one, because that really then does lead to sometimes significant purging. And the problem is if that happens like more severely, then you can get scarring just from that alone. So we don't never want that to happen. And then just a little bit more on that, when people do go on to oral treatment for acne, like isotretinoin, they can also get quite a bad purging from that. And as doctors, we can prescribe sometimes like a low dose of corticosteroid orally to take for a few days. So there's always some hope. But with topicals, usually we don't do that. We try rather to do that gradual introduction, get your skin safely what we call retinized over time. We actually have a word for that. So that's why when people say your skin gets used to it, it's actually getting retinized. It's like reconfiguring the epidermis slowly, and that's why it's better to just ease into it and not all at once. So yeah, if that helps, if that makes sense, yeah.
Does that make sense, my angel? Alrighty.
I think, like with most ladies, my beauty counter at home looks like a click store. What I would like to know is, does this product play well with others, or should you not combine them?
I don't know if I got the first part. You said
Most of our beauty counters at home look like a click store. We've got so many different products.
yes, yes.
So does CeraVe play well with other products, or should we not combine them?
Oh, word, eh?
So sorry. I'm also struggling to hear.
Sorry.
Do you mind just speaking up? A lot of makeup.
Like, do you mix? Is it fine to mix the product with other brands?
Oh, okay. Yeah. So look, you don't have to commit to using a single brand. I think it is sometimes nice to simplify things and stick to one brand, but every brand has some hero product that is excellent. I feel like with CeraVe, it is a complete, package. If you go with the blemish control range, for example, or if you need a night cream and a day moisturizer with SPF 50, they have that as well. But of course, you can definitely mix things. Or you've had a good experience with another product that works differently and you want to introduce that, or like a recommendation from a friend or something like that, then that's fine. It's okay. I think it's just knowing not to put too many of similar type of ingredients together where you then get like the skin barrier breakdown. So like not to use a retinol with a very hectic exfoliating acid at the same time. So that kind of a thing. So I think, again, if you're not sure, I think there's lots of stuff now available online and things, but obviously you can always see a professional, a doctor, a dermatologist, even just a general doctor, or even a skin therapist. They're also excellent. So rather be sure about what you're doing and not cause your barrier to break down because you want to use too many actives. Yeah.
Alrighty. Thank you so much. I think that's our time.
That's it.
Yeah.
That is our time.
Thank you so much. Thank you to more girls. Thank you
I just
to
wanna have fun, clap my hands, turn around now and dance, dance, dance. I I just wanna have fun, clap my hands, turn around now and dance, dance, dance. I just wanna have fun, clap my hands, turn around now and dance, dance, dance. I just wanna have fun, clap my hands, turn around now and dance, dance, dance.